Now let's talk about loop diuretics. These are the high sealing diuretics, and 15 to 25% of the glomerular filtration rate appears in the urine. It is highly efficacious and its effect increases with the increase in the dose. It is needed to There is no need to combine with the others to potentiate the action, and it is an emergency diuretics as it causes maximum diuresis. It also can act in severe renal failure where there is only GFR 10 or lesser than 10 milliliter per minute. The drugs used are furosemide, ethacrynic acid, bumetanide, and torsemide. Now, mechanism of action. It inhibits sodium potassium 2 chloride co-transport present in the luminal membrane of the thick ascending limb of loop of Henle. There is decreased reabsorption of the sodium, potassium, and chloride, and it increases the excretion of the sodium and potassium. This is a picture showing the mechanism of action of loop diuretics. There is a decreased intercellular potassium. There is decreased back diffusion of the potassium, and there is decreased positive potential. There is decreased reabsorption of the calcium and magnesium, and there is increased excretion of the calcium and magnesium. There is increased sodium downstream, which leads to loss of sodium, loss of potassium and hydrogen, leading to alkalosis. It induces synthesis of the prostaglandin and increases renal blood flow, leading to increased glomerular filtration rate. It also have direct effects on the blood flow through several vascular bed. Now, pharmacokinetics. It is rapidly absorbed, out of which torsemide is more rapidly absorbed. The duration of action is furosemide 2 to 3 hours and torsemide is 4 hours. Half-life depends on the renal function, and the diuretic effects depends upon the secretion by the PCT. It is metabolized by liver and excreted by kidney. Now, clinical uses. For acute pulmonary edema, edema due to liver, lung, and heart disease like heart failure and acute renal failure, hypertension, acute hypercalcemia, hyperkalemia, anion overdose, hepatic cirrhosis and ascites, and nephrotic syndrome. Now, adverse effects. Hypokalemic metabolic alkalosis, hyponatremia, hypokalemia, hypochloremia, hypovolemia, hypocalcemia, hypomagnesemia, hyperuricemia, ototoxicity, allergy, and may decrease lithium clearance. Now, contraindications. Patients with sulfur sensitivity, pregnancy, gout, hypocalcemia. Now, drug interactions. NSAID with indomethacin, probenecid, sulfur drugs, aminoglycosides. Now, advantages of the furosemide over other diuretics. It is high efficacy drug, high ceiling, and maximum diuresis is 15 to 20% GFR. It can produce forceful diuresis. Combination with other drugs is not needed. It can act in severe renal failure. Glomerular filtration rate 10 milliliter per minute. Rapid onset of action. So, how does this drug act in congestive cardiac failure? By diuresis, by hypovolemia, and prostacyclin release.